Right, now, we were going to talk about the decadence in the healthcare sector, as against what it should have been. So much had been spent, even in the Aso Rock Villa Hospital in Abuja, where it is expected that by now it should be a standard. Many people may not be going into that place, but at least people within the hierarchy, people within the government, people within that level should be able to get that kind of health care. But they keep going outside of the country to get it because we have not arrived there. What do you think is responsible for such decadence in our healthcare system?
Being able to have a sustainable plan, you need to know where you got it wrong. I had a meeting in Los Angeles in last year, July. And right there, we were able to analyze the life expectancy of all the countries in the world. A number have already reached 89 years and all that. While Africa, Nigeria seated 218th position and with a life expectancy of 55 years. So when I came back, I started wondering, because when I look at the map of Africa, I realized that this very low life expectancy of our people ranges from the West African sub-region, where you have Sierra Leone 50 years life expectancy, Chad 52, Nigeria 55, and all that. So I started wondering what could have been responsible, because if you look at the North Africans, Tunisia, Morocco, Egypt, their life expectancy is for 75 years and above. Whereas we also still in Africa could record something less than 55 years and going down. What could have been responsible? Then I discovered in that particular map of West Africa, most of the countries there are all colonized. Colonized by French, colonized by Britain, colonized by Portugal, and all that. So that very colony happened to have this low, unacceptable life expectancy. Because of what? We grew up and formed our government with the mentality of a slave. A slave does not think about his health. He only thinks about his stomach. So that's why once you give a slave food, irrespective of his health condition, he goes into work. That is the nature of the slave. And that's why that character is imbued. I mean, when you talk about government, who is a government? Government is me and you. It is something that one person from 2000 down to date we are doing democracy. It has been people coming into government and going out of government. So it is not the government per se, it is the inherent nature of the person that is forming the government, and is forming the government with a mentality of a slave that does not care for his health. That's why here we can buy a car, we can buy houses, we can spend millions on this, but when it comes to your health, you pray. As a matter of fact, even when you are to spend money in the hospital to be able to get your body back to go back to business, as you are spending it, it will be paining you. Doesn't it do you?
I don't think so. Because as a matter of fact, I like to take care of myself.
You don't have to deny it. It's a natural thing. It's we call it intrinsic. It happens that when you want to, as you are spending for your health, it will be paining you. In your mind, you'll be saying, is it not the money I would have used to do something else? That is something more important than your hair. Correct. So that's why, if you look at our health budgets, that will explain a lot to you. The woman called Elizabeth Warren. Elizabeth Warren happened to be the Democratic presidential aspirant in the United States. She was making progress of almost being a nominee. But only for her to be in position to say, hey, I'm going to give America free, that's Medicare for all, meaning that free health care for all Americans. They called her and sat her down. I said that what you are proposing is impossible in America. That what you are proposing will cost America 52 trillion US dollars in 10 years. 52 trillion US dollars. That translates to 5.2 trillion per year. When you divide that money across American population as an individual budget America has, it's about 17,300 US dollars. In our own money, using our former exchange rate, you may get about 6.2 million naira. That is American budget for an individual citizen of America per year. 6.2 million naira. All right? I want you just to have that as a clear picture of what is obtainable. When I came back, I went in to study Nigerian health budget from 2000 to 2019, a 20-year span. And from my study of those budgets, Nigeria has been able to do a total health budget to the Ministry of Health for 20 years, totaling 3 trillion 687 billion 392 million 111,676 naira. That is the total amount Nigeria has spent, budgeted, implementation notwithstanding, budgeted for 20 years. If you take that particular money, 20 years divided by 20 years, you will get around 184.4 billion naira. That is to say, in a year, what is actually budgeted for the entire Nigeria to be in position to survive averagely for that 20 years is 184 billion. Divide it by our population. For our population, if you divide it for our population of 200 million, you will get 922 naira per person. For 1 year, 922 naira is not able to buy anti-malaria drug. So that gives you the picture of our healthcare system. In 2001, April 2001, there was a gathering of all the African head of states in Abuja. And they proposed that Africa country should be given 15%, allocating 15% of their total budget to health. As I'm speaking, countries like Rwanda, Malawi, Burkina Faso, Niger, they've surpassed 15% to their healthcare sector. But the highest we have been able to do in healthcare in Nigeria is 5.95% in 2012. In 2012, that is the much we have already been done. So when you look at that particular value, put it and you discover that what we have been running for the past 20 years in healthcare is recurrent expenditure. There is no room, as a matter of fact, when you look at the actual implementation, there's no room for capital expenditure that should be able to upgrade the system. Do you understand? So looking at also, effort was made 2015, there was a bill that was passed, what is called a National Health Act. I don't know if you're aware of that. And that National Health Act stated that 1% of the consolidated revenue fund should go to the healthcare, but 75% of it to the healthcare development agency, National Healthcare Development Agency, which will manage 45%, and 5% should be medical emergencies. At least for this kind of a situation we are having right now, there's a fund that's supposed to have been there. That actually did not reflect in our budget until 2019, and that's in that 2019, 50.22 billion was now allocated as part of that particular fund, 1% of the, but it didn't represent the 1%, because we actually budgeted 8.83 trillion naira for the year. So the 1% is supposed not to be 50.22. But funny enough, instead of that money going to those ministries that it was actually represented, it was also put as a statutory fund under the Ministry of Budget and National Planning. So the whole issue has to be in position. We need to be able to revamp our healthcare, number one, mentality. The people should understand. Of course, coronavirus have been able to tell us very, very clearly that your health is your life. People say health is wealth. You see, well, your health can be well. Where are the private jets? The liabilities to people that have it. Everybody's running about his health. Do you see what I mean? So coronavirus have been able to let us know that if you lose money, you lose something. But if you lose your health, you lose everything. So it is the reason why we are shut down right now is because of our health, not because of the car we park and all those kind of things. So it is time we begin to, first of all, revolutionize our minds in such a manner for those that will form government tomorrow. They will get to understand the value. Thank God for what is happening in the healthcare industry. When there be a positive response, we also have a commendation to it, because you just don't have to be only on the critics. Let's be able to share a positive testimony as it is, because I'm glad that the secretary to the federal government, Boss Mustafa, came on board also having identified the situation on ground, and the government right now has been able to also make a provision for the issue through the CBN intervention fund to be able to upgrade the healthcare system, something that should be applauded. But beyond that is the sustainability. You get what I mean? Beyond that is the sustainability plan. What is the sustainability plan for this? First of all, it's not just only looking at the government, because when people look at the government, and I say in the next couple of years, maybe 2023, we will have another set of Nigerians that will still be the same government. So we should not, the first thing first is to be in position to revolutionize the mindset of people in area of health care. What if I don't care for myself? Of course, I may not be able to care for you.
Okay. Now, if I am to give you 100 billion naira, as the CBN has done, what would you put on ground as facilities to be able to take care of the situation you're talking about right now?